Hi, I'm Dr. Perry Godalovich, and in this video, I'm going to be reviewing the consent form for breast reduction. Breast reduction surgery is a day surgery under general anesthesia that lasts about an hour and a half. The risk of general anesthesia today is safer than driving in a car, but there is the risk of developing a deep vein thrombosis, which is why we give you socks to wear for surgery, and nausea and vomiting, which we've prescribed medication for. The risks of a breast reduction are actually fairly benign. It is a fairly straightforward procedure. It's 2 days of pain, 2 weeks for the skin to heal, 2 months for the breast to settle, and 2 years for the scars to fade. The scar is in a boat anchor pattern around the nipple areola, a vertical scar, and a horizontal scar. The main risks of the surgery are bleeding, which is extremely rare, something called a hematoma, which is a collection of blood in the breast. If that were to happen, normally it would happen in the first 24 to 48 hours, and it would not be subtle. One breast would be double or triple the size of the other one with a purplish discoloration and a lot of pain. I've seen this only once in my practice, and we do a lot of breast reductions. Infection is also extremely rare. This is probably because we give everybody antibiotics the day of surgery and for 7 days after the surgery. What people will often describe as an infection is a small healing problem, usually at the junction of the T incision, and this can happen between 10 and 20% of the time, more commonly in the summer because of the humidity. The key to preventing this is keeping the area dry and clean and avoiding humidity and sweating in the area. Other risks of this surgery are aesthetic risks, meaning that there can be differences between the two breasts. Most women do not have equal breasts to begin with, and we do our best to give you the most symmetric result possible, but there can be differences between the two sides. In addition, there can be changes to nipple sensation. Generally, this is temporary and will return to normal between 6 months and a year. For patients who have very large breasts, there can be a risk if we reduce the size too much to the blood supply to the nipple. I've seen this once in my practice where the nipple will die off and we'll have to reconstruct it in another way. It's extremely rare and generally in a very, very large breast. The scars also can take time to heal and will fade over 2 years, and we don't recommend any scar treatment for the first month. We will give you some scar recommendations at your 1 month point.